Jesse Rogers sitting in for Ben Kitili. Welcome to Kenya's premier Sunday morning political broadcast. This is Inside Politics. Now today we take a look at the plight of frontline healthcare workers. This week, through their union KMPDU, doctors issued a 21-day strike notice. They blame the government of exposing them to the coronavirus vulnerability. This even as the counties blame the National Treasury for lack of release of funds to counties, hence an upsurge of COVID at the community level. We assess the management of the novel coronavirus so far in Kenya. We also highlight the BBI game plan, which seems to be at crossroads. The launch of the signature drive was postponed, followed by a meeting between the president and his deputy. What does all this mean for the search of consensus? Is there hope of a non-contested referendum? We evaluate this. Also, we might be building bridges right here in Kenya, but the Horn of Africa is bleeding. From fears of civil war in Ethiopia between the federal government forces and the army of the Northern Tigray People's Liberation Front, better known as TPLF, to the state of democracy in Uganda, which many critics argue that the democratic space is shrinking ahead of the election slated in January. Stay with us for the next 120 minutes as we dissect the biggest political and policy issues in the Republic and beyond. And our panelists today, familiar faces, so let me get right to it. Kipchumba Karuri, who's an advocate, many thanks for making time. Dismas Mukua, political risk analyst. Hesbon Owila, who's a political commentator, and Mark Bichachi, a communication strategist. Last but definitely not least, Gloria Oroba, who's a youth policy analyst. Gentlemen and lady, many thanks for your time. It's always a pleasure to have you with me this Sunday. Now let's start with the latest in terms of the doctors' COVID-19 onslaught. The country's medical fraternity continues to bear among the biggest brunt of the COVID-19 pandemic in Kenya, after 2 medical doctors succumbed to the virus over the last 24 hours. Nephrologist Dr. Anthony Were and dental surgeon Dr. Neera Patel now join a growing list of 12 medics who have all died from the coronavirus in just a week. The deaths denting an already struggling health sector whose workers are threatening to down their tools in 2 weeks' time if nothing is done to change the worrying trend. Let's take a look at that report by Timothy Otieno.
The news of the death of the 64-year-old senior doctor who served as the president of the African Association of Nephrology and deputy director of the East African Kidney Institute does not come easy for the over 7,000 medical doctors in the country who have been on the forefront in battling a global pandemic. Dr. Anthony Were passed away at the intensive care unit of the Nairobi hospital on Saturday morning after battling the virus for more than a week. His death, announced on social media by the Kenya Medical Practitioners, Pharmacists and Dentists Union, came just 3.5 hours before yet another medic would succumb to COVID-19. Celebrated dental surgeon Dr. Neera Patel, also killed by a virus, which has now claimed the lives of 12 frontline workers in just 10 days.
Daktari, thank you so much for speaking to KTN News.
It's a situation the country's doctors' union say may hurt rather than help Kenya's fight against a second wave of the coronavirus.
With every single death of a doctor, then the doctors on the ground feel demotivated, and they feel demotivated and scared because it could be them, it could be any one of us. But more importantly, the fact that up until now, it's not clear how you get compensated, how you get treated. There's still medical bills to be catered for.
It's for that reason that the doctors' union issued a 21-day strike notice, which lapses on the 6th of December. In the strike notice, the medics are agitating for improved access to personal protective equipment and a comprehensive healthcare package, among a growing list of concerns for Kenya's medical fraternity, which on Wednesday this week drove some members of parliament to tears over the manner in which the doctors were being treated.
I don't like this.
Why, easy, easy.
You can't do that to your doctors and your health workers. It's not fair. It's not fair.
But for the 32 medics who have died from the virus since March this year, the empathy comes a little too late. Already, the Kenya Medical Practitioners and Dentists Union are sounding a warning over the lack of effective directives meant to resolve the growing concern.
The issues that we had brought forth in our strike notice are yet to be resolved. So just know that with every death, doctors are fast losing their morale.
Our healthcare workers are also part of the community, and that it is, you cannot tell whether a healthcare worker got infected in the hospital or get infected in society where they actually, where they normally reside.
I want to urge the government, the Ministry of Health National, to at least endeavor and give full medical cover for all frontline medical workers.
5 months after the country lost its first medic to COVID-19,
I am Adisa.
doctors launched a rigorous campaign to push the state to offer them meaningful assistance in the global fight. But with more deaths and little solutions, could the concerns by Kenya's medics be falling on deaf ears? Timothy Otieno, KTN News.
Well, that's the big concern. Could their concern be falling on deaf ears? We'll definitely try to deliberate on that. But healthcare workers, in short, through their union KMPDU, have accused the government of exposing them to injurious working conditions and expose them to the coronavirus vulnerability. We'll try and assess this. So let's just start with our panelists right now. Mark Bichachi, I'd like to start with you. Taking a look at the words by the KMPDU chair, Samuel Oroko, who said, doctors work by day and night, but when they fall sick, the government can't cater for them. When soldiers get injured, the government airlifts them and caters for all expenses. They're all in the line of duty, irrespective of where they caught the virus. Talk to us.
Definitely, that is true. Today, as we speak in this war against COVID, our frontline officers on duty are indeed the medical fraternity. It's not just doctors, it's the nurses, it's the orderlies, it's the dentists. It is basically anyone who puts their life in danger to secure the lives of fellow Kenyans, and that cannot be understated. The government does have a responsibility in this case to ensure the safety of our medics, and I'm including everybody, including the nurses, the orderlies, and everyone who works as a healthcare worker. Because if we don't take care of them, then the reality is there's no one to take care of our society, and our society could very easily crumble because of COVID-19. So there is need for county governments, number one, because health is a devolved function. County governments need to start quickly telling us what they did with the billions of shillings that they were given by the government for COVID preparedness. You can definitely see some counties are more prepared to deal with COVID than others. Secondly, the government, I think, has backtracked on NHIF and is going to provide NHIF cover for a lot of these medical workers, and they should do that post-haste. This is one of those things that they should put a lot of resources and time into to ensure that not only are doctors taken care of, but also Kenyans have a sense that should they fall sick, because this disease seems to be not going anywhere, at least for the next 5 or 6 months until vaccines are available, it's not going anywhere. So the government needs to actually step in and fill that gap and make PPEs available, give insurance, give the best healthcare to our doctors. That no one can argue against that.
All right, Bichachi, and I get your point, but on that issue of county governments, and I'd like to bring Hesbon Owila on to this point. Earlier on the week, they actually mentioned that they didn't just show hospital beds and ICU facilities just for the sake of the camera, but also later on through the Council of Governors chairperson, Wycliffe Oparanya. He mentioned this, and allow me to just quote him. "We sympathize with our frontline workers, especially those working in isolation centers, but there is nothing much we can do to help them because National Treasury has refused to give us money. I think he's talking in the present tense. Delay in release of funds by Treasury to counties has sort of been blamed for the upsurge of COVID at community level. What's your take on this?
Well, I think this is not the time for blame games because we live in a country that has a very high, doctor-to-patient ratio. And instead of starting the blame game and blaming the national government, I think governors owe us an apology, first of all, and an explanation. Because a lot of resources were devolved to the county governments, and county governments even showcased, their preparedness, almost all the counties. But then what we've seen is that they've lied to us, because if a doctor dies in Eldoret, because there isn't, a facility to take care of that doctor, if a member of parliament dies in Kakamega, and all member of parliaments can do is ask for helicopters on standby, then we are living in a very dire situation. And these are times that MPs should not be asking for helicopters to evacuate them. They should actually be asking county governors where is the money that they've been given since March to put up facilities. And I think that is the first critical issue, that governors need to take responsibility. Then the number two is that there is a conversation between the central government, treasury, and governors. And of course, there is that provision that the medics are going to be taken care of. And I think the onus on most leaders today is not just for lip service. We don't want press conferences. We want to see our medical health workers and doctors taken care of, because there are two things. Guys keep saying that they are our frontline workers. Yes, they are. But you see, they're also our last line of defense. So if we don't have them, then when we get infected, who do we resort to? So a number of things come to the fore, that to what extent are these medical doctors and healthcare workers equipped properly? And I think they've raised that. And instead of leadership blaming each other and MPs talking about evacuation, they should ensure that each and every medical doctor, healthcare worker in this country, wherever they are equipped with quality PPEs. We cannot have PPEs lying at KEMSA waiting for prices to go up. They will never go up. They need to release them to these medical doctors. Then another thing is we need to interrogate the schools that were used as isolation facilities, yeah? To what extent were they sanitized enough to allow students to go back to school? And could they be exposing most of our kids and then therefore overstretching our medical health system? In September, and I think this is a very critical issue, in September, Cabinet approved a comprehensive NHIF cover for medical healthcare workers and doctors. And we are still asking ourselves, why did it have to wait until last week, for the ministry to start this conversation after doctors had issued a strike notice? I think we need to be very proactive. We need to come out and speak to these things, because it is doctors who take care of us when we fail as the first line of defense and get infected. So to the extent that these conversations have started, I would expect all our leaders now to start looking at the nitty-gritties. When there is a comprehensive cover, does it cover doctors sufficiently? To what extent are we having isolation facilities for these doctors when they are infected? At the moment, 2,500 healthcare workers are infected. But the reservation for taking care of these doctors caters for only 30 beds. So if majority of them are in critical conditions, you need to ask yourselves, we only provide for 30%, for 30 beds to take care of 2,500 people, which is a critical issue that we need to attend to. What doctors are asking for, what medical health care workers are asking for is not too much, given that they are our last line of defense. Right. But I think most importantly is two things. We cannot have medical doctors looking for funds to get the services that they provide to Kenyans. And then number two, we cannot have medical doctors and healthcare workers put their lives on the front line, and there is no provision for compensation. Those are critical things that will give them the motivation to attend to Kenyans.
Quite certain. Motivation is quite important. Dismas Mukua, let's take a look at the demands and just expand on what Hezbollah Wheeler has mentioned. In their statement, while they're issuing the 21-day strike notice, they mentioned standard PPEs to all healthcare workers, comprehensive medical cover and workmen's compensation for all doctors, permanent employment to 2,000 doctors currently under contract terms, and the list goes on. But my point is, 9 months into the fight of the novel coronavirus pandemic, and there seems to be no clear guidance on how doctors will be compensated, or let's say have their medical bills paid, since they do not have comprehensive insurance cover. What do you say to this?
What the medical doctors or healthcare workers are asking is a no-brainer. It's very basic. That's why when you send your soldiers to go and fight in Somalia or wherever it is, you give them the necessary resources. When we send our troops to Somalia to fight Al-Shabaab and other extremists, you don't give them knives, you give them rifles and the resources they need to win this war. So 9 months later, and our healthcare workers don't have this capacity, is a national embarrassment, and we need to begin from the beginning. The last week we saw a member of the National Assembly shedding tears, Dr. James Nyikal, highly regarded medical doctor in Kenya, but he was shedding tears as if he's a village man in Mosocho. This is a member of the National Assembly who has capacity to pass budgets, to give medical doctors whatever they need. And another MP says that because we are high-profile members of society, instead of having healthcare the entire nation, please can you have standby choppers at Wilson Airport so that in the event that we fall ill, we are airlifted to Nairobi. So now you begin to wonder, what is the role of the National Assembly and what is the role of Senate in Kenya as far as fighting COVID goes? Because these are the people who have capacity to pass legislation to give these healthcare workers resources to fight COVID. And in my view, these people probably have no business being in those offices. They must find it necessary to resign, not tomorrow, but today, because they have displayed impunity, mediocrity, and corruption. They have also demonstrated that they have no capacity to assist President Kenyatta in fighting COVID, because these are the people who have got the constitutional mandate of passing budgets. And then what do? They're shedding tears. What do? They want now to pass a budget to give them special helicopters on standby. What happens to Murai Mosocho? So as far as the legislators go, they've been a successful failure. Then number two, going to Afya House, it seems that they are shooting in the dark, because as we have this conversation, they've not made public any kind of strategy they have, which has got short-term and long-term objectives, both strategic and tactical, so that all Kenyans understand where we are today and where we are going tomorrow. They've not done for us the critical path analysis and identified what are our key success factors. So you are told to put on a mask, sanitize, keep your social distance, and do all these things so that you don't get the disease. What happens when you get the disease? So right now, what the minister does or cabinet secretary does every day is to just come and give us statistics. But those statistics count for nothing if they're not followed by concrete action so that we know where we are going. I don't know why we have not embraced the Cuban model, which has placed a huge premium on our primary healthcare. So as far as I'm concerned, these people have been alleged down to President Kenyatta. They've been given a responsibility to fight COVID, and they're joining the rest of us in the streets, shedding tears and asking for helicopters. And then for some reason, we believe that this thing is going to be a success. One still wonders whether Mutahi Kagwe actually has got key performance indicators when he goes to bed with his, when he goes to bed and wakes up in the morning. Does he have really key performance indicators knowing that this is what my team is supposed to achieve? Or does he just wait for a list, a news release, and then he tells us these are the number of deaths and this is what is happening? And then the last point about healthcare workers. In my view, every Kenyan ought to have either the public or private insurance, because every single life in Kenya matters, whether you are a medical doctor or whether you are a hustler in the village, every life matters. But because we are limited by resources, on the bare minimum, we need to give our healthcare workers additional resources, because we are told that the first line of defense and the last line of defense. It's a pity for medical doctors to come on board and say they don't have PPE, or sometimes they're given faulty PPE. And then what do our MPs do? They just shed tears and they want more helicopters.
Now, speaking on additional resources, Gloria, looking at the doctor-patient ratio, 9,096 doctors against a population of 47.5 million. I mean, 32 deaths in the medical field is one too many. What's your take on our priorities ever since this coronavirus pandemic hit Kenya. Have we tackled it in the most efficient way possible, bearing in mind the challenges that are facing the economy?
Thank you for having me today, Ben, on the show. Matter, I would say that, to be honest, with the type of leaders and the type of human resources that we have in government, I would say that they've tackled it the best way that they can. Because this is what we are showcasing the capabilities of, for instance, our cabinet secretary. When he goes to national television and sits and talks very pridefully about the things that he thinks he has done as the head of that ministry, without actually being in touch with what is really happening on the ground. He's not necessarily, he can hear the medical health workers and the caregivers, he can hear them, but he doesn't really understand that these people are actually, they are saying that we are lacking resources, we are lacking stakeholder engagement from government, we are lacking, like, you people are not really understanding what we are going through. So for me, I actually have reached a point of accepting that maybe this is the best that this government could have done in terms of handling this pandemic. And, you know, I read a report on what a leading virologist, Professor, I think it's called Anzala, and the numbers he had given out. He had talked about, you know, we were anticipating 300,000 Kenyans would have been infected. We are anticipating about 45,000 Kenyans would die, 2 million would be affected. And he did all of that quite early when the pandemic actually was in Kenya. And so we were hoping as Kenyans that maybe those kind of people would be brought to the table. They'd be, you know, really engaged in terms of putting together a resiliency plan. And even as much as they are just putting out the stats and the data, they would actually, as like government would be able to say, these are the technocrats who understand what is happening in this country. And so therefore we have to listen to them and try and use their expertise. So if you ask me, I really, I'm coming to the understanding that we have done the best that we can, because the leadership that we have in terms of our cabinet secretary, in terms of all these bureaucrats who are used to just, you know, slowing down processes and are focused on procurement and processes that are there to enrich them. I guess this is really what we are capable of as this government. I take on it.
Okay, okay. We'll definitely add a voice on that. Kipchumba Karuri Wakili, I know you haven't spoken to this. I'll give you a chance after the break just to give your take on the fight against the coronavirus in the country and the plight of the medical healthcare workers. Let's just take that short break, but when we come back, we'll also take a look at the BBI game plan, which sort of seems to be at crossroads. That is, since the postponement of the launch of the signature collection drive, and then we had a meeting between the president and his deputy. This slowed down momentum for the push. How long will the waiting game continue? Stay with us.
It's possible. After the meeting,